Hi everyone, welcome to Derma Bites with Dr. Viv. I'm Dr. Vivian Okuta. Today I'll be talking about dandruff. I'm sure most of us know what that is, where you have the itching and the flaking of the scalp, and sometimes on the face and other parts of the body where hair follicles exist. Now, a lot of people think that dandruff is because the scalp is dry or they wash their hair too often, or they also don't practice fantastic hygiene. But you know what? This misconception will lead you to treating it wrongly and not getting the results you desire. There are other forms of dandruff which are more severe. We have seborrheic dermatitis, where there's excessive oil production, and then also psoriasis could lead to dandruff, which is really severe. So the treatment modalities for those are totally different. Now, dandruff can start after puberty, because at that point the hair follicles and the oil glands are stimulated by the circulating hormones, which will now lead to the increase in production of oils. So children before puberty do not develop dandruff in the true sense of the word. A treatment modality has to be followed for you to get the results. Now, the time where there's the highest incidence of dandruff is by age 40. So that is the time when many people have dandruff and they're looking for treatment. Now, when there's this hormonal stimulation, the glands produce a lot of oil, and that is responsible for the greasy texture of dandruff. And there's also associated inflammation and itching. Now, the rapid cell turnover plus the excessive oil production leads to the condition. There are some triggers as well that make dandruff worse. If you're stressed, if you have hormonal imbalances, neurological conditions, and infections. Dandruff is also mainly caused by the body's reaction to a yeast called Heterosporum ovale. I hope I pronounced it correctly. That naturally occurs on the scalp. And there's a natural scalp turnover, that's the skin on the scalp. You know, the cell turnover is accelerated when this infection or when the fungus proliferates, and that leads to dead cells flaking off. Now, as I had said before, that there are several conditions which may aggravate it if you already have it, like stress, your diet, the hormones, climate as well, and heredity. So it's something, it could run in some families. You know, you could inherit it from one of your parents, and also it's this fungus, because it actually feeds off the lipids that encourages it to continue to grow rapidly. So it likes the fatty acids. Now, if you're fighting this organism, you will have to make sure you use the right products. Now, most of you have the flaking, the itching, and the discomfort, and sometimes it could be really sore and weeping. So these are the the symptoms of dandruff. Now, we treat dandruff with antifungal agents for starters, so that's the best way to tackle it. So you have to aim to kill the yeast, as well as sometimes the secondary infection with bacteria, and also exfoliate the dead cells because of the flaking. So kill the yeast, exfoliate the dead cells, and you also try to reduce the rate at which the skin renewal process is on in this condition. Now, to get rid of the yeast, you would look for shampoos with these active ingredients like ketoconazole, selenium sulfide, cyclopyrox, and zinc. So when you're buying your shampoos, please look for these ingredients. Now, there are also over-the-counter shampoos as well. So the ones I just talked about are those prescription shampoos. Now, when you're looking for the exfoliating ingredients, those would be like salicylic acid and glycolic acid, because with these help to exfoliate the scalp. And you should also look for tar. Tar is something that helps to slow down the cell renewal process. And if you're somebody who has flare-ups, you may need topical steroids. Like, they're available in liquid drops, which are massaged into the scalp, then a shower cap is worn at night, and by the next morning it's washed off. Now, in cases of psoriasis, the cell buildup is so thick, so there's crusting, discomfort. So in this situation, steroids are also used, but in the form of a mask, which will be applied to the scalp at bedtime only. And of course, you have to wear like a shower cap to sleep too. So, but then for facial dandruff, there's this is a condition where you have the dandruff on the eyebrows, the in between the brows, and also what we call the nasolabial folds, you know, here, from here to here. But you know what, dandruff, as I had said earlier, could occur on any part of the body as long as there's a hair follicle. So it's really, really interesting how this happens. Now, for facial dandruff, there's special creams available that have antifungal as well as steroids, a combination, but these are prescriptions. So you would have to see your doctor to be able to get a prescription. Don't go, you know, just treating haphazardly, because steroids in particular could be harmful to the skin when not used properly. Now, it is important for you to realize that dandruff is controllable, but it's not curable. Thanks for listening.